Good afternoon, everyone. My name is Ed Chung from the Center for American Progress, and welcome to Coronavirus, What You Need to Know. This is the first in a series of virtual events that we plan to bring to you to provide valuable information and analysis. But before we begin, allow me to extend, on behalf of CAP, our best wishes to each of you. We hope you're looking out for yourself, your physical and mental well-being, and that you're practicing physical distancing, and that you're taking all the appropriate steps for your own sake, for your friends and families and neighbors, and for just our society and community writ large, because we're all in this together. COVID-19, as you all know, is a global pandemic, and there are many different ways that policymakers from all levels of government are attempting to address this crisis. So we want to use this time to provide you with facts and dissect what is happening in the country and globally. One place that you can get information, the latest information, is our website, which is www.americanprogress.org. That's www.americanprogress.org. You'll see on our homepage at the top and in the middle a link that leads to a collection of all of our reports and briefs and products related to COVID-19. You can always follow us on Twitter. Our handle is @amprog. That's @AMPROG. And please use the hashtag #UnderstandingCoronavirus. Joining me today are three experts in their respective fields, all of whom happen to be my colleagues at CAP. First, we have Mara Kalson. She is the Managing Director of our Health Policy team. We have Kelly Maximum, Vice President of our National Security and International Policy team. And Andres Vanelli, Vice President of our Economic Policy team. We'll be sure to leave some time at the end for questions from the audience, so please take advantage of the questions tab. It should be located on your screen on the right side, in the middle, or the bottom, and we'll get to as many questions as possible, but we will be sure to get to at least some of them at the end of our presentation. But Mara, let me start first with you. We want to talk about numbers. Facts in this day and age are incredibly important. So if you can give us a sense of the numbers of people first who have been tested positive for COVID-19, also, unfortunately, the people who have the fatalities as a result, not only here in the United States, but globally as well.
Yes. As of mid-morning today, we're approaching 500,000 people who have been diagnosed with COVID-19. About 22,000 people have died from the disease worldwide. Here in the United States, we're also seeing cases just really increase very rapidly. Again, as of this morning, we had about 70,000 cases, 1,000 deaths, and most of those cases are still active right now. We still have about 67,000 active cases.
Are there any specific regions in the United States that you're keeping an eye on specifically?
Well, I think everybody's really keeping an eye on New York City and the surrounding counties. Right now, that's really the epicenter of the crisis here in the United States. Looking out a couple of weeks or so, I think people are really going to want to watch carefully places that did not put in place social distancing rules or regulations, or that were behind in doing that. So I wouldn't say really it's even within a state, you might even have some variation of, if the governor didn't act, you might see some of the mayors in that state act. So Florida is sort of an obvious example of a state that really did not take appropriate social distancing measures until later.
So one of the things that obviously goes into the numbers is testing, and I think one of the issues that we've heard of is the availability of testing. What are those numbers, if you have any, of the number of people who've actually been tested, and is testing available more widely now than they have been before?
It's more readily available now. It's still very spotty. It still depends on where you live. I mean, I think it's a helpful data point is to compare it to South Korea. South Korea really had the most vigorous testing response so far of any of the nations who have had COVID pandemic hit them. And in South Korea, it's about every person for every about 140 people, there's been a test. Here, it's for every for every 800 people, there's one test. So we would have to have roughly I mean, we'd have to have millions and millions of tests occurring to be at the point where South Korea is right now. I think what's important talking about testing, though, is kind of step back a moment and think not just the numbers, but why we want to test. I mean, we want to test because testing is really the key linchpin of the public health response. COVID is very contagious. It's stealthy. You can be asymptomatic. You can be asymptomatic and never really show any disease. You can be asymptomatic and then suddenly you have very serious symptoms. So in theory, the idea is you isolate the people who test positive, regardless of whether or not they show any symptoms. And then you do what's called contact tracing, and you try to figure out who the person who's tested positive has had contact with. So the lack of testing here in America is what's really driving our very aggressive social distancing protocols, because we don't have that ability to really target who needs to be isolated. So moving forward, we need to not just increase our number of tests, but we also need to increase I shouldn't say increase, we need to improve the type of testing we're doing. We need to know where the cases are. Are people getting better or worse? What's the percent of the population? Because right now, different places are really testing at very different rates. So we need to know, not just the raw numbers, but, what population are you testing? And then it's also going to be really important to test outcomes and to figure out who is getting these diseases and are there certain people are having better or worse outcomes for different reasons.
One of the things that is on top of mind, something that you've analyzed recently, is the effect of social distancing and physical distancing. What's the latest evidence on whether or not this type of policy is actually working?
There is a lot of evidence internationally. I've mentioned South Korea a couple times here. South Korea was incredibly aggressive in terms of their testing and their monitoring and their social distancing. A lot of what they did in South Korea is obviously not appropriate, or Americans would not necessarily want to have that level of surveillance. Even in places like Italy that you wouldn't think have success stories, there are pockets of parts of Italy where certain towns really closed down, and we see real differences in the rates of transmission in those cities versus the rest of the nation. Here in the U.S., a few things. We are really early in this pandemic. So it might feel like social distancing, physical isolation isn't really working. We need to give it time. And we're also never going to really you can't completely eliminate the transmission. You have people who need to go out, you have doctors, you have essential workers. You also have to have the policies in place for the entire time of the incubation of the disease. With all those caveats, we just released a paper yesterday that looked at some really, really preliminary evidence. I think the one that I would highlight for folks is Kentucky versus Tennessee. At every sort of step of the development of the pandemic, Governor Beshear in Tennessee has been ahead of Governor Lee in Tennessee. They shut down the bars a week earlier, and you could see actually the trend line change after the bar and restaurant ban. Kentucky now has a stay-at-home order, and Tennessee doesn't. So that's going to be one place to really look at for evidence of social distancing.
One of the recent announcements from President Trump has been his intention and desire to reopen the country and lift some of the guidelines or rules that that the federal government pushed out by, I think he was saying, Easter, which is about 2 weeks from now. Is this, from a public health perspective, a reasonable timeline?
No, it's absolutely, it's reckless, and it's reckless and so dangerous. If you were looking at the peak cases, in most places, peak cases won't even be occurring that time. Experts are saying that peak hospitalizations in many places won't be until May. So it's absolutely reckless. And in many places, I should say, in most of the country, state and local leaders have really been far ahead of the federal government in their response. So I think the key thing is really for the state and the local officials to really keep following the advice of public health officials. I'm sure Andreas will get into this, but I also just think it's a false choice. Quote unquote, opening up the economy when you still have a deadly pandemic and you still don't have the capacity to treat everybody is going to have not just devastating human toll, but it's also going to have a devastating financial toll, an economic toll.
Yeah, let's bring in Andres Vanelli, head of our econ team at CAP. Give us your take on, from an economist point of view, what you look at when you're not only looking at the economy writ large in terms of the possible recession that we may be in, but also the intersection between that and our public health.
Well, saving lives and saving the economy go hand in hand in this case. That's very, very clear. If we were to attempt to go back to normal, many lives would be lost, and we wouldn't be able to go back to any sense of normal in the economy because people would be very scared and looking at basically the people piling up in hospitals. What we need to do in order to fix the economy is to fix the public health situation. That is done by flattening the curve. What that means is basically we will slow the spread of this disease, so the demand on hospitals goes down. At the same time, hospitals can revamp a lot of those ventilators that people talk about, the number of beds, the sheer supplies. So basically, you increase the supply of medical goods. You also buy a lot of time for doctors to learn by doing and find more efficient treatments for this disease and eventually some kind of vaccine. What we need is not to set a date. We need a set of real science-based conditions that will allow us to gradually go back to normal. That would be the optimal path for the economy, I believe.
Let's take a step back and if you can give us a sense of what the main economic effects of coronavirus has been. I mean, we heard just today the unemployment numbers in the millions. Just how deep and how long do you think this crisis will be?
Well, there's a lot of things going on at the same time. Basically, factories are not working, people are staying at home, not shopping. The stock market and all the financial markets went down. Um, it all adds up, and it's all happening around the world at the same time and sort of reinforces each other, right? This adds up to a pretty bad shock on the economy. Today, we saw unemployment claims going up by 3.3 million people, which is a record, and it's 4 times the previous record in '82. So it's big and it's bad, unfortunately. Um, the consensus seems to be that this quarter that we're on is going to be bad. The second quarter, the next one, is going to be lousy. Okay, maybe I don't know, maybe 30% of GDP going down, something like that, and then gradually climbing back towards the end of the year. It's very difficult to give any sense of precise numbers because of two reasons. One is we don't know exactly the medical um, uh, characteristics of COVID, so that matters a lot. So it's a medical problem. The other one is that we are very uncertain about the economic policy response by the administration. What we do know is that they took a long time to react on this. Homer Simpson was asleep at the switch. When they woke up, they had a manual of procedures about what to do. They didn't follow the manual. When they basically woke up, they called Congress and said, we want 2.5 billion with a B, billion dollars to treat this thing. This was at the beginning of the month. By now, we're talking about 2.5 trillion with a T of treatment, big stimulus. They got it wrong, but they got it wrong not by a little, by 1,000 times. They were 1,000 times wrong, and now there's problems with supplies like ventilators. Those checks that will be in the mail will take some time to get. We lost a lot of time here. Fortunately, now Congress has taken leadership. They filled the leadership void and they're doing big things, and that's a very good thing now.
So let's talk a little bit about what Congress is doing. This is the third major COVID-19 related bill that Congress is currently considering. The Senate last night passed their version of the bill, and the House is now considering it. Could you give us a sense of the economic provisions in the bill, just an overview sketch, and the things that you are most closely watching?
Yeah, I mean, it's a huge bill. Perhaps it's the biggest price tag in history that I'm aware of. But we have a big problem, and this is what makes sense here. I would say that there's help there for individuals, for a lot of people. Most people would get checks. There's help for organizations, and there's help for public health. Okay, most notably, help for people. We have unemployment insurance going up in size, going up in reach. It's going to reach people in the gig economy and people who are independent contractors, and it's going to go for longer than usual. Then there's going to be a lot of mailing of checks for most Americans out there. Average Americans will be getting thousands of dollars of checks, which is a very good thing, direct payments. There's help for hospitals, for scientists to look into this thing. There's help for businesses, most notably small businesses. State and local governments who are really in the front line here are going to get quite a bit of money. It basically all adds up to $2 trillion of help, which is going to be coming handy, and it's the right thing to do in this environment.
Andres, we'll come back to you in 1 second. I want to turn to Kelly Maximum, who is the head of our national security and international policy team. Kelly, one of the things that you've been tracking has been the supply chain for crucial medical supplies, especially because many of these supplies are made overseas. What are the most critical items that are needed in the US right now to respond to COVID-19, and why don't we have them?
Yeah, it's a very good question. I mean, I think folks have been seeing in the news, I mean, I think the first big critical shortage is ventilators. And we actually do have a national stockpile of medical supplies that has been drawn upon in cases like 9/11. In our national stockpile, there's only about 16,600 ventilators. And if you look at what Governor of New York, Andrew Cuomo, is asking the federal government for help on, it's over 20,000 ventilators. So that's all we have in our national stockpile. So it's a massive shortage. There are about 160,000 ventilators in the US healthcare system across the nation. However, most of those ventilators are already in use. And so we're talking about a real serious gap on the ventilator side. The other piece, of course, is personal protective equipment, face shields, masks, gowns, things like that, which is also a critical shortage. On the mask front, China actually produces over half of the world's face masks, N95 masks. And of course, they've been using those for domestic reasons and have not been exporting them even after the peak of their crisis. So we have a real serious shortage. And this is where I think the federal government needs to step in and start taking action soon.
So on that front, last week, President Trump said he was invoking the Defense Production Act, but he hasn't actually used it. Could you explain first what the Defense Production Act is, and again, why the president decided not to actually, put it into practice and that we're not utilizing it?
Yeah. So the Defense Production Act was signed in actually 1950. It was part of the Korean War effort. It was an attempt by the federal government to mobilize a national war response. So, directing industry, for example, steel and aluminum, to support machinery for war purposes. It has been used, since then in very sort of specific and narrow ways. But this is exactly the kind of national crisis that the Defense Production Act was made for. And so what it really can do, there's sort of three key areas. First, under Title I, the Defense Production Act, the administration, for example, could go to a ventilator manufacturer, some company that already does ventilators, and they can say, we're going to get ahead of the line in terms of purchase orders. So we're going to bump all of your customers, whether they're private healthcare systems, state governments, et cetera. And then they can say, we're going to not only do that, but we're going to reallocate those sources around ventilators around the country. So they also have an allocation authority. The second place they can really do, thing they can do is in the case where there is not existing capacity, like we don't have an industry producing certain goods. So that's when the government can come in and say, we're going to expand, we're going to use funding, incentives, loan, purchase guarantees, essentially to build out that kind of industry. So in places that it doesn't exist. But what's happening right now is the administration isn't really engaging on any level on this. They're starting to think about allocation authority, but they're not really doing much on that front either. And FEMA actually walked back its comments the other day that said it was going to start doing that. So
one of the issues that comes up also, because as you mentioned, a lot of these products are made in China or overseas, is our international relations. And usually in these types of situations, the United States has played a leadership role in responding to crises like this. Is that happening now? And how strong or frayed are our international relationships at the moment?
Yeah, I mean, I think we're not doing a very good job leading internationally on the COVID response. We're not even doing a good job leading at home on it. As you can see, there's been some news recently about the G7 foreign ministers meeting, where the United States has sort of insisted on using the term Wuhan virus, and therefore the foreign ministers couldn't come to an agreed joint statement on action. So we're not really leading in the sort of multilateral space. It goes against everything the Trump administration believes in terms of multilateralism. We're watching America first here unfold in real time. The U.S. should also be thinking about ways it could cooperate with countries like China and South Korea and Italy and others on what are the best economic responses, what are the best medical and scientific responses. How do we work on security issues related to COVID? But none of that's really happening so far. The United States could also be, for example, trying to figure out how to look at sanctions regimes against, even adversaries like Iran and Venezuela and North Korea, and thinking like, how do we generate space for medical supplies to get to these countries? Should we be lifting or doing carve-outs on sanctions? Should we be easing sanctions? Should we be offering assistance? But right now, very little of that is happening in real terms. There's a lot of rhetoric about it, sort of fake offers of assistance. But the U.S. certainly isn't doing all that it should be doing at this time.
I want to ask a question of each of you. This comes from our audience, and just a reminder for those of you who may have joined a little bit late, there is a questions tab on your screen, so please be sure to send questions in. We'll try to get through as many of them as possible. But this is a question from Jill, and I'll just start with you, Mara, and go to each of you. Given that Trump will not do what is needed, what are the top 5 things you recommend governors do? I think this is a great question. Mara?
Yeah. Number 1 is keep their social distancing policies in place. To the extent that states don't already have some of the stronger social distancing pieces in place, like stay-at-home orders, consider if that's necessary. The number 1 priority, I think, of the state leaders and mayors and other local leaders really needs to be follow the advice of public health officials who really are the experts that we need to be listening to here. I would say the corollary to that is the longer that there are stay-at-home or other social distancing measures, the cities and states really need to make sure that those who are higher risk are able to receive resources. So I mean, there's many examples, but I would just say children who need school lunches, and make sure that there are adequate resources, and not just resources, but adequate operational pieces in place to make sure that low-income children, for example, in my example, are receiving food that they need and are able to continue to engage in school and learning. So I think that it's number 1 is really the public health piece, and number 2 are some of the pieces that they need to take to be able to mitigate some of the ongoing downstream effects of the public health interventions.
Andres, how about you?
Well, really in line with what Maura was saying, I think that what we need to do is basically focus on execution, mailing checks, doing the operational stuff, following in a coordinated fashion what's going on the federal and international level. People have to be leading by example, move fast, move early. That way we're going to be able to come back to normal earlier. Just do not delay those decisions.
Kelly?
Well, I would say 2 things. One is put pressure on the federal government to implement the Defense Production Act immediately, as soon as possible. I think we're losing serious time. I know Governor Cuomo has been out there calling on the administration to do so. I think other governors need to do so. The second piece I would say is, the Defense Department and the military does actually have a significant amount of capacity to provide. But what the best thing it can do is actually refine the asks for DoD, refine the asks for the National Guard, give them a set of requirements. Say, we need a hospital capacity of 500 beds in X county. Then the Department of Defense and the Guard can take those kinds of requirements and figure out how best to deliver that. The Army Corps of Engineers has been very successful in cases like this. So really having a set of refined asks for the military.
Yeah, and Kelly, on that, oh, go ahead, Mara, please.
I'll let Kelly finish her piece, and then I would love it if you would circle back to me.
Yeah, Kelly, I was just going to ask, I mean, you've been part of the national security planning operations and process at very senior levels in DOD and the White House. I mean, what are the parts, I mean, has this apparatus been, utilized in the proper way, coordinated? What else could be done?
Yeah, unfortunately, as everyone has seen in the press, the Trump administration eliminated the Office of Global Health Security, which sort of had responsibility for a pandemic in the National Security Council. I actually think the fact that that wasn't around really set them back in terms of, having a set of playbooks that were already in place, people who kind of understand pandemic and how to leverage state, local, and federal government really right there, ready to go. So that really set them back. I think, they have established a task force, which is good, but it's been kind of a task force with multiple heads. So you've got Trump, you've got Vice President Pence, you've got Dr. Birx, you've got Dr. Fauci, and it seems to be kind of everybody's in charge. That's a nightmare in terms of how you're coordinating with not just across the federal government, but with state and local governments as well. So they really need to have a singular point of contact and somebody who's clearly in the lead. The other piece is, clear and consistent messaging. There is just that you cannot understate how important that is in a crisis, whether it's a national security crisis or a domestic health crisis like this. And the fact that the messaging has been all over the place and really inconsistent is the worst thing you can do. They're working with state and local officials, working the private sector. It's got to be a key piece of this. They are doing that. I don't know how coordinated it is and how onesie-twosie it is. The one thing I think they really missed early on was leveraging the capacity of the Department of Defense. I think that they were just completely blind to the ability of DoD to support a national pandemic response, and they didn't make the asks early of the department. And the department, frankly, was very slow in offering up its assistance and its capacity. So I think, just to be in summary, I think the response, the coordination has been poor. I think the communication has been poor, and I think they've been very slow to leverage the national security enterprise.
Thanks for that, Mara, please.
The other piece I'd like to flag that governors have a lot of flexibility to use is Medicaid, their state Medicaid programs. Congress acted not this time, but the time before, to increase how much federal money goes into the system. But there's a lot of different ways that states can cover more people, can make the Medicaid program available for free testing, for example. And it really, there's a lot of flexibility there for governors to use those funds in the Medicaid program to make sure that people are covered and to really try to drive the public health response in the state.
That's great. Thanks for that, Mara. We have another question from the audience. I think this is directed towards you, Andres. It's from Victoria. What provisions are necessary to support workers in the gig economy?
Yeah, a lot. I mean, what I would say in general is that this recession is showing how unprotected we were as an economy before this hit us. So for instance, unemployment, usually when you're in the gig economy or you're an independent contractor or self-employed individual, you're not covered by unemployment in any normal way. Now in this last bill that Congress is considering now, they're adding those people to that, which is the right thing to do. But how about we made this permanent? This is the right thing to do in any situation. So the good thing about this crisis is that it's showing to us how important basic common sense things like including people in the gig economy for unemployment, making sure that everyone has affordable health care on a moving forward basis, paid leave for everyone. 1 in 4 people in the private sector do not have paid leave. Of course, now we have a little bit of an emergency thing going, so now they have it, not everyone, but some. All these things, we should take care of these people in any situation. Of course, now is the right thing to do and it's been done, but we need to make these things permanent.
Thanks, Andres. Another question from the audience, and Mara, we'll start with you on this, but if anybody else can chime in, that'd be great. How does this virus, or maybe it's to Andres as well, how does this virus that sparked the recession disproportionately impact marginalized communities? including those who are lower income, Black and brown communities, and immigrants and others. This is from Danny. Mara, you might be on mute.
Sorry, I will put in an early plug. Some of our CAP colleagues are actually putting together a paper that should be out hopefully tomorrow on this exact topic. In terms of just, there are many impacts. The one that I will start with is just, even though there have been strides over the past 10 years to cover a lot more people and to have people have access to healthcare, people of color, immigrant communities are still disproportionately uninsured and what we call underinsured. So they might have some sort of coverage, but it's really not affordable for them to use. So I think that just having that disparity in health coverage, any sort of epidemic like this is also just going to exacerbate existing disparities and impacts that already exist within the healthcare system. We don't have any evidence of this yet, but we're expecting to see it. For example, with some different strains of flu, African Americans have a higher mortality rate. They don't necessarily have the flu, get certain strains of flu more often, but because of the underlying health conditions, access to hospitals, things like that, they have higher rates of hospitalizations because they get sicker. So again, I think that the paper that's coming out tomorrow covers a lot of this.
Let me add something there, which is something we wrote about already on our webpage, which is that many people in disadvantaged communities, people of color, are disproportionately the people who are helping out delivering healthcare these days, taking care of old people, taking care of kids. But these people are at the same time they have less coverage of health. Basically, they tend not to have basically sick pay leave as many people do. So these are people really saving the day, and we're treating them very, very poorly. That last bill that the Congress is considering does not include an increase in SNAP and WIC for people. We need to make sure that that happens in the near future. This is going to be urgently needed. The other thing that we need to make happen is we need to declare people working in grocery stores. Okay, many of these people are from disadvantaged backgrounds. We need to declare them necessary workers. They're delivering the food to our tables. They're necessary. We have to declare them to be necessary so their kids can go to childcare and get childcare. Okay, this is very, very necessary. It's the right thing to do for them, but it's also the efficient thing for the economy.
Great, thanks for that from both of you. We have a question from Elena. What about Governor Cuomo's point about sending supplies to each state as needed and then passing to the next crisis? How do we work together nationally to do that? Kelly, I'll direct that to you.
That's a really, really great question. And this is why it's so important to have a very unified and comprehensive federal response. You know, what the federal government should be doing, and actually FEMA would be in the lead on this. There's a National Disaster Response Center that's in place. FEMA should essentially be fielding the requests from states, determining where the biggest need is, and just, you know, working with, for example, the Defense Logistics Agency to help, you know, distribute supplies, much needed supplies to those places most in need. So that should be happening. That's not what's happening at the moment. Right now, it's states versus states. It's not just states versus states. It's states bidding against, you know, private medical companies and firms. So really, this is why a federalized effort needs to be underway, and this is what the DPA exists for. This is what the authorities under the Stafford Act exists for, and the National Emergencies Act exists for. And so I think Governor Cuomo is right. I mean, I think that we're going to have to make some really tough trade-offs. There are going to be places that require much more assistance, and this is where only the federal government can step in and really push industry to produce more ventilators and masks, figure out where they need to go, and then has the capability to actually logistically deliver them. This is all about logistics. At the end of the day, this is not, you know, sort of rocket science. This is just logistics, and this is where DoD, FEMA, HHS should be working together to figure out how to do this.
Thanks, Kelly. We have a question from Aaron. What are the chances that higher temperatures, humidity, give us a reprieve, and what would that look like? And also, what are the chances that the outbreak is less bad in less dense populations? For example, New York City, Wuhan, Italy, all have areas, at least as New York City is very dense. Mara, we'll turn that to you.
There is a lot of speculation that as temperatures rise, the virus maybe there might not be as many transmissions, that the cases will go down, in large part because of evidence from other past flu epidemics. The problem with, yes, it could happen. What we saw, for example, with the Spanish influenza about 100 years ago was that, yes, in fact, the cases went down over the summer, and then the virus came back far more seriously, and some of the worst part of that epidemic happened the next fall. So, that's just something for epidemiologists and infectious disease experts will be following really closely. The idea that it's just going to magically go away when it gets a little warmer, I think, is some unhelpful information, because I think it also undermines the real need to keep social distancing, regardless if you have a warm day or a cold day.
Great. Thanks, Mara. We have several questions on the economy, and I think the best way to just answer that is, Andres, given your background, what are the other measures that, even if this bill passes, this multi-trillion-dollar bill passes, what are the things that the federal government, the Fed, other places should be looking to? We saw the Fed take some pretty historic steps as well, agreeing or being open for business to buy bonds and mortgage-backed securities, et cetera, et cetera. What are some other things that the government should be doing and looking at?
Okay, let's start by the Fed. The Fed has been taking leadership here. It's a bunch of very, very smart people. The Fed knows when to hold them, when to fold them. And right now, what they have done is they have gone all in. The Fed is all in. They lowered interest rates to zero. They are buying bonds left and right, basically anything that they can get a hands on. Why? The question is why? Let me tell you. The idea is that basically, since rates are zero, Uncle Sam can finance himself with 0% interest, right? So Uncle Sam gets zero. What they're doing is passing those savings to the rest of the economy, okay? So interest rates for people like us with mortgages, or for businesses that need credit lines or need financing for their operations, those interest rates will be going down because basically the Fed is allowing the government to pass those savings to us, okay? What we now need is for the rest of the government to also go all in. And this bill that hopefully clears through the House very soon, it goes a long way in this direction, but there's a bunch of things that are still missing. We were talking about paid leave, for instance, right, for people who are sick. Let me tell you, in the previous bill, there's a huge loophole that's people close to the administration inserted, and people haven't been talking much about this, but basically, if you have more than 500 employees, you don't have to pay medical leave for people. If you're big, you don't have to do it. It's a crazy loophole. We have to fix it right now. There's a lot more assistance that is going to be needed for hospitals, for state and local and tribal governments, through Medicaid, okay, SNAP and WIC, those food stamps and all that, in desperate need for all that. We will need probably more payments for our sagging workforce. Maybe more checks if this thing lasts for longer than we hope for. So there's a lot of work to be done here, but this is a very good step so far.
Great, thanks, Andres. Want to take another question from Sundari. How will this affect the supply chain in the future, not just for medical supplies, but for manufacturing in general? Will there be a resurgence in the manufacturing sector in the US? Either Kelly or Andres, direct those to you.
Well,
Andres?
let me take a stab. I think that what we have seen is a globalization of the supply chain that has worked quite well, but basically this situation showed that we are not resilient enough. Okay, so we have to rethink our perspective here. We have to think about strategic supplies for the nation. Okay, that's something that hasn't been done. We have to rethink our terms of trade with the rest of the world to make sure that basic protections for workers and for environmental principles are embedded in anything that we have to that we do concerning trade. We need to look at intellectual property issues regarding technology. There's a lot of thinking to be done, and we shouldn't waste this crisis. We should get thinking right now.
I would just
Kelly?
add to that, I think that someday when this national crisis and global crisis winds down, I think that there's going to be a lot of work that has to be done in terms of looking at how we responded, what lessons we can learn from it, what gaps do we need to fill. And I think this is where I think Congress, the administration, any future administration needs to be doing some real work now. I mean, just for example, just the national stockpile, just alone, it clearly wasn't enough for this kind of pandemic. And so really thinking about how to fill the national stockpile in ways that it wasn't currently filled. So that's just the tip of the iceberg, I think, in terms of the lessons learned from this crisis.
Kelly, we'll stay with you. Question from Jeffrey. What are the perils of Trump's belligerence towards China? And are we on the verge of a new Cold War?
Yeah, this is a really complicated situation. I mean, obviously the Trump administration has been in a posture of competition with China. But in the context of a global pandemic like this, we've got to also figure out ways to work together to manage these crises because, pandemics don't have borders and they don't really care what ideological affiliation a government has. So we really have to think and work hard to maybe, I would encourage the Trump administration to sort of shift some of its posture. That said, China, wasn't perfect in its response. It wasn't super transparent in the early days. It is in many ways spreading disinformation out there about how the United States Army started this. So it's kind of a mixed bag. But I think the larger lesson is that at a time of global crisis, just sort of hunkering down into our nationalist perspectives isn't actually going to affect anything. And we need to actually work more closely together on issues like this or on issues like climate change, things that are going to be, have global impact.
Thanks, Kelly. I think we have time for one more question. This is from Nida or Nida. Yesterday, Dr. Fauci said that COVID-19 could be seasonal. Other than the development of a vaccine and effective treatments, what can be done to prepare for future outbreaks? Mara?
Well, I think it's a little bit of what we've talked about all day, really making sure we're testing so we see where the hot spots are, making sure that we're isolating people, making sure we're still tracking things when if there's a lull in cases, and taking that time to really make sure that we are becoming more prepared to respond to the next round of this prior to any sort of vaccine becoming available, widespreadly available. So both things. I think it's really a time to prep, but also, again, just really underscores the importance of what this event started talking about was really testing, and how that really is the linchpin to so much of what we've been talking about.
Great, thanks for that, Mara. Oh, please, Andres, go ahead.
Yeah, let me add a little point on the economic perspective. We need to be better prepared economically for the next one. What that means is many of the things that we have been in a crazy scramble to get done in the last week or so should be made permanent, right? People need to make sure that when they show up in a hospital, they get a very reasonable bill, not a crazy bill. Okay, people need to know that when you're sick, you don't have to show up at work because you don't have any way of putting food in your table. So medical paid leave should be made permanent. Okay, we need to make sure that Medicaid is fully funded. We need to stop attacking those programs. our safety net is going to save us from this one. We have to enhance it for the next one.
Great. Thanks for that, Andres. I want to thank all three of you for joining us. And before everybody starts logging off, I just want to thank you all for joining us as well. Be sure to take advantage of those links that you see on your screen. Go to our website, americanprogress.org, for more resources. Follow us on Twitter at AMPROG, AMPROG. Use the hashtag understanding coronavirus. We hope to bring more of these to you. So be sure to tune in, be sure to follow us and get information. Again, as I think been the theme, please continue to practice physical distancing, and please take every effort to ensure that you and your families and your neighbors are safe and healthy. Thanks so much for joining us. We'll see you soon.